Emergency response procedures for newborns and infants. Hello. This video has been created to explain cardiopulmonary resuscitation for newborns and infants who are unresponsive and not breathing. Please refer to the following information to help ensure that bystanders can respond quickly in emergency situations. Cardiopulmonary resuscitation for newborns and infants. Newborns and infants refer to children up to the age of 1. CPR is necessary when a newborn or infant is unable to breathe properly due to airway obstruction, respiratory failure, neurological disorders, or sudden infant death syndrome. Unlike adults, where arrhythmias are common, the primary cause for CPR in infants is usually difficulty breathing. Cardiopulmonary resuscitation procedure for newborns and infants. Check for response. If the newborn or infant appears pale or unresponsive, place the baby immediately on a flat, firm surface. Stimulate the baby by gently tapping the soles of their feet and checking for any response. Request help and call 119. Shout out to alert those nearby, and immediately call 119 for emergency assistance. Chest compressions. 30 compressions. If the newborn or infant is unresponsive and not breathing regularly, perform 30 chest compressions. It is essential to perform chest compressions with the correct position, method, speed, and depth. The compression location should be at the center of the chest, just below the nipple line. Use 2 fingers or 2 thumbs to apply pressure, compressing to about 1/3 of the chest's anteroposterior diameter, roughly 4 centimeters deep, at a rate of 100 to 120 compressions per minute. If chest compressions are performed too quickly, proper blood circulation may not be achieved. Artificial respiration. After 30 chest compressions, administer 2 breaths. To do this, lift the baby's chin with one hand until the ear and the floor are parallel, and tilt the head backward with the other hand. Be careful not to tilt the head too far forward or backward. Deliver 2 breaths simultaneously into both the mouth and nose. Continue 30 chest compressions to breaths. Continue performing 30 chest compressions followed by 2 breaths until 119 arrives, or until the newborn or infant begins breathing on their own, their skin color returns to normal, and movement is observed. There should be no delay when transitioning from chest compressions to breaths or from breaths back to chest compressions. Spontaneous breathing is confirmed when the chest rises and the baby breathes deeply. Do not stop CPR if there is shallow or irregular breathing, or if the chest does not rise. Once 119 arrives, or after the newborn or infant has recovered, transport the baby to the emergency room. Heimlich maneuver for newborns and infants in case of airway obstruction. Airway obstruction caused by foreign objects is a common emergency situation in newborns and infants. Infants under the age of 1 are unable to cough or express discomfort, so if you notice a hoarse voice, a hoarse cry, or cyanosis, it indicates airway obstruction. In this case, the Heimlich maneuver can be performed as an emergency treatment. The steps are as follows. First, contact 119 and initiate the Heimlich maneuver. However, if the infant is unconscious, immediately start CPR. If the foreign object is visible in the mouth, you can attempt to remove it. If the foreign object is not visible, do not attempt to sweep the mouth with your fingers, as this could push the object further into the airway. Check for signs of airway obstruction and confirm response by tapping the soles of the feet. Check for signs of airway obstruction. Tap the soles of the feet to confirm the infant's response. If the infant is unconscious, start CPR immediately. Request help and call 119. shout out to alert those nearby, and immediately call 119 for emergency assistance. Back slaps. Support the infant's face with your hand, keeping it facing downward. Hold the baby at a slight incline with the head pointing downward. Then use the palm of your hand to deliver 5 firm back slaps, directed from the back toward the head. Since the infant's ribcage does not fully protect the abdominal organs, apply moderate pressure to avoid causing injury to these organs. Chest compressions. While maintaining the position with the head facing downward, use 2 fingers to apply pressure to the center of the chest, just below the nipple line. Compress the chest to a depth of at least 1/3 of the chest's anterior-posterior diameter, approximately 4 centimeters, and perform 5 compressions. Repeat until the foreign object is expelled. If the infant loses consciousness, switch to CPR. Continue repeating 5 back slaps and 5 chest compressions until the foreign object is expelled. However, if the infant loses consciousness during this process, immediately switch to CPR. Only chest compressions should be performed if the foreign object has not been expelled. This concludes our guide on how to perform CPR for newborns and infants. Thank you.